It's always great to be in Western North Carolina. We just had a sit-down with public health directors and healthcare providers in Western North Carolina to talk about COVID-19, the new coronavirus that has swept across the world. I announced today in Raleigh that we had 5 more positives, and now North Carolina has 7 positives for this new coronavirus. We have spent quite a bit of time analyzing the science and the data, consulting with public health experts, businesses, the CDC. On the basis of that, we are announcing a list of new recommendations, and I have declared an emergency order for the state of North Carolina, a declaration of emergency. I have with me Dr. Betsy Tilson, who is going to go into a few of the details of the statewide recommendations that we're making. But this declaration of emergency that I have signed allows the state more flexibility. It allows us to have more flexibility in hiring experts that can help us deal with this health situation. It also helps us to draw down funding. It activates North Carolina's price gouging law. It encourages insurance providers to waive co-payments, and we're going to work very hard to make sure that testing or cost, that finances are not a barrier to testing for this new coronavirus. We also want to provide a list of general recommendations for people. We're going to talk about people who are in certain categories. We have a higher risk category that has a different set of recommendations that I'm going to have Dr. Tilson talk about. But for people who are not in the higher risk category, we just want you to keep in mind some simple things. We want people to live their lives, but we want them to do it wisely. And making sure that you wash your hands frequently, making sure that you cover your mouth and nose when you cough or sneeze, that you try not to touch your face, and to try to wipe places and disinfect places that you use with regularity. Those kinds of things can help mitigate the spread of this virus. We want people to keep those things in mind as they live their everyday life. I'm going to recognize now the State Public Health Director, who is going to give us some of the more specific recommendations that we have made statewide in North Carolina so that people can think about what they're going to be doing tomorrow and making sure that they keep these recommendations in mind. So Dr. Tilson?
Great. Thank you, sir. And as we've been thinking through this definitely is a rapidly evolving situation. We're closely monitoring it and understanding if we need to make different recommendations. But in our first stage, what we're really doing is focusing on who are those people at higher risk of having more severe disease with this infection. And so we are really focusing a lot of our recommendations on protecting the most vulnerable amongst us. So for our statewide recommendations, what we are recommending is, in accordance with also the CDC guidelines, is that people who are at higher risk of severe illness, and I'll explain what we're saying, those criteria, but for people who are at higher risk of severe illness, we're recommending that they avoid large mass gatherings, large community events. We're also recommending that they avoid mass travel on airplanes and cruises. And people, as we're defining as high risk, are those that are 65 and over or have underlying health conditions including heart disease, lung disease, diabetes, those kind of things, or a weakened immune system. So that's our general guidance for high-risk people, very much in accordance with the CDC guidance. In addition, the other area of population at very high risk are those people in what we call congregate living facilities, so things like assisted livings, nursing homes, we know are very at high risk. And so for those facilities, one, we're making sure they know the CDC guidelines in terms of proper cleaning, in terms of proper prevention, infection prevention, but we are also recommending that there is a limiting of visitors and then a restriction of visitors who are sick. And that is a way we're hoping to decrease the introduction of the virus into our skilled nursing facilities, our long-term care facilities that are very high-risk population. In addition, in terms of mass gatherings for statewide, what we're recommending is that the event planner encourages people who are sick to not come to the event, also to encourage people who are at higher risk, again, that's over 65, have an underlying medical condition, to not attend the event. And that we are asking our event planners to adopt lenient refund policies for people who are at high risk. We're also asking our event planners to see if there's any way to space people out as much as possible, to encourage people washing their hands, having hand sanitizer readily available, and to be sure that they're cleaning surfaces very regularly. In terms of our travelers, we are recommending that people who are returning from, some people that are returning from areas like China and Iran are being funneled through airports that are not in North Carolina, but our other travelers from other high-impact areas, we're asking them to also follow our guidelines in terms of symptom monitoring and make sure they let either local health department or their provider know if they have the first signs of symptoms. Those are our new statewide recommendations. In areas that are affected, in specifically the Triangle, in this case, we are having some additional recommendations for those areas that are more effective. So those are our recommendations for today. Continuing to monitor, this is changing hour by hour, and we may be making new recommendations as we go forward.
So we'll now take your questions that you might have.
Can you
Yes.
briefly describe the test we're waiting for the FDA to approve? I know there are several blood-based antigen tests being used in Asia. Is it something like that? Is it another antigen-based test?
One thing I want to emphasize is that a lot of our preparation has been based on the promise by the CDC to make sure that they provide the supplies that we have the testing capacity, but there are certain extraction agents that we need in order to perform the test that way. That has not been coming from the CDC as promised, and we're not the only state that has experienced this. So we're now working through other methods. One of those is encouraging private labs to come up with their tests. LabCorp, which is headquartered in North Carolina, has already begun the process of their tests out there. And we're also working to ramp up a testing procedure in our state lab that does not involve this supply that is, or the supplies that are hard to get right now. And we're hoping to have that online soon. Dr. Tilson might have other information on that.
Yeah, and specifically your question about the antibodies. So the test that we're using actually looks at the genetic material of the RNA virus, not the antibody. And so the piece that we are missing is what's called it's the extraction assay, where you actually extract that RNA, that piece of gene, from the virus. So that's the test that we are using.
We understand that there could be somebody in quarantine at Part E. Would that be the first in the western part of North Carolina that we know of? And I mean, is there anything you speak on that?
There are no known cases in the western part of North Carolina. We, as we had always promised, that we were going to let people know as soon as we know there's a positive. Of our 7 cases, there are 6 in Wake County, 1 in Chatham County. So there's no one that I'm understanding is in quarantine due to exposure.
Have there been any tests requested or done on patients in western North Carolina?
There certainly have been tests done on people. I don't know specifically from western North Carolina, but we are definitely making sure that that testing is available to everybody statewide.
Are there any recommendations for colleges, maybe in terms of online classes or?
Yeah, so one first thing is that the CDC has done really a great job in putting together an enormous amount of guidelines. So that's a really, really great place to go. Our website also, we have put guidelines as well, and is where there's a great resource of the CDC. We're doing that as well. So one, make sure you're aware of that, and through our website. We're in pretty close conversation with a lot of our institutes of higher education, including with UNC. For right now, we are not recommending school closures, but I think the idea of telelearning could be something to think about. But again, you have to think about where is there broadband? Can you do that statewide? So we are in close communication with our institutes of higher education, and at this point are not making that recommendation.
One thing that's important to note, the president of our university is former head of the CDC, Dr. Bill Roper. So that's always helpful. He's been talking to the secretary of our Department of Health and Human Services. And we do have a website. It's ncdhhs.gov/coronavirus, which provides a lot of information that we've just given and more, in fact.
And we could take one more question.
Can you talk more about the living facilities and the restrictions you're putting in there, the recommendations? A lot of retirees have moved to Western North Carolina in recent years. Down like Brevard has a very high percentage and concentration of them. Can you talk more about that?
We are making these as recommendations at this point, but what we have, the feedback we've gotten from nursing homes, adult care facilities has been very positive. I mean, the last thing they want is a situation like is in Seattle, where you have a confined, high-risk population with a virus that spreads pretty easily. So we're getting a lot of cooperation. And Dr. Tilson, I don't know if you wanted to add to that.
Yeah, sure. And we have a group that works specifically with our healthcare facilities. And then, again, CMS just put out some very detailed guidelines of exactly what that looks like in the nursing home facilities. We're going to be taking that and also pushing out very granular level of what we mean by limit and restrict, so that people can use that as very detailed guidelines that they can go by.
I understand that local health organizations are in charge of local quarantine and isolation procedures, but in conversation with the Buncombe County people, they also weren't certain. I understand that Cordon Sanitaire, a firm line somewhere, is beyond the power of our county health department. Who in North Carolina holds that power?
Yeah, so Cordon Sanitaire, which is a lovely name, that is something that we are not considering right now. That is far down the road. And I would have to double check on who has the authority for that amount of a measure. I'm not sure. We can check on that.
Thank you all very much. We appreciate it. Thank you.